Welcome to Top Athlete, a center for prevention, treatment, rehabilitation of sports injuries and musculoskeletal conditions. Today, I'm discussing factors delaying recovery of injury in sports. It is true that you can sustain an injury, but it ends up taking longer than expected to heal. What causes this? We define full recovery as being able to return to sport at the athlete's previous level of play without re-injury. Number one factor that delays healing of an injury is wrong initial management. Once you sustain an injury, the initial mode of management is very important as it initiates recovery. When done wrongly, it worsens the conditions, leading to other complications, hence delaying the recovery. Number two is misdiagnosis. Incorrect diagnosis of an injury leads to wrong treatment, which in turn will end up delaying recovery. Make sure a detailed history is taken and necessary investigations done for a proper treatment. Number three, general health of an individual. Good immunity helps the body fight infections and helps in the healing of damaged tissues. Poor health delays healing of injuries due to inadequate nutrients necessary for recovery. Number four, going against medical advice. Players sustain injuries but refuse to go for medical treatment, sometimes due to personal beliefs. This definitely leads to delayed recovery and other complications. Number five, ignoring rehab. Some injuries lead to surgeries. Thereafter, you have to go through a step-by-step rehab process to help in proper recovery and regain your fitness. Ignoring this step could lead to delayed recovery and other complications. Number six, wrong rehab. Rehab is a step-by-step process and you need the guidance of a professional who understands the injuries well. Doing incorrect exercises during rehab could lead to delayed recovery of an injury. Number seven, inability to afford medical expenses. Treatment can be too expensive, especially to individuals who aren't financially stable or have no insurance medical covers. This can lead to lack of treatment or partial treatment, and that can lead to delay in healing. Number eight, age. The older you get, the slower the healing process becomes. The inflammatory response is decreased or delayed, as is the proliferative response. Remodeling occurs but to a lesser degree. Number nine, cause of injury, location, and the tissue involved. Severity of an injury dictates the treatment method and recovery period. Most mild injuries recover with rest, but severe cases require surgical interventions. Number 10, training with the injury. It's good to avoid activities that can cause more damage to the injury or cause a new one because training with an injury is a risk for both. Number 11, multiple injuries. Sustaining multiple injuries definitely delay recovery period and the return to play program because the management is a bit complicated compared to a single injury. Number 12, psychological factors like fear of movement. Some patients get scared to perform some activities, especially during the rehab process for fear of re-injury or unrealistic expectations for recovery, or some get into depression. And number 13 factor that delay healing is obesity. In cases where non-weight bearing is advised, excessive weight can be a challenge, especially when using walking aids like crutches. So it's always good to try and control your weight gain. As always, thanks for subscribing to my channel and viewing my videos. For any inquiries or booking of appointment, call the number on the screen. And also, please don't forget to like, comment, and share this video to all sportsmen and women in the world. Top Athlete, a healthy and physically active body.